Let's now look at the COVID numbers across the country. And if we look at the national capital, Delhi continued to see its case count fall as the city reported a further drop in the cases. Now, Delhi's COVID cases dropped from 12.5 thousand to 11,684 new cases in the last 24 hours. Mumbai, on the other hand, saw a marginal rise in the number of cases that went up from 5,956 to 6,149 in one day. But it's down south that the numbers are rising. The state of Karnataka has seen a huge jump as the cases have spiked from 27,000 to 41,000 in just a day. Now, after the big jump in cases, the Karnataka government has ordered strict enforcement of containment measures. The Karnataka Chief Minister has asked the district authorities that are lagging behind in vaccination to raise their jab coverage by the end of the month. Meanwhile, the member of the Karnataka Genomic Surveillance Committee, Dr. Vishal Rao, has suggested that states should consider booster doses for the 18-plus age group as well. Listen in.
And I think Israel was one of the first countries that came up with it, and then there was a lot of data that came out of the real world from Israel in the Lancet and many other journals now that have published this, showing that there is a waning immunity of these antibodies after 6 months. And that's why I think a third dose is something that I feel is necessary. Now, this is my opinion that 18 to 60 years group is the one that is most active socially and economically. So while we are now talking about, yes, comorbid people need priorities, healthcare workers or frontline workers are also in the priority, eventually we will need to open this up for this 18 to 60 years age group, because I think this is the key age group, eligible age group, that also is a part of running the social and the economical activities of the state or in the society. And it is important that a third dose is necessary.
Point of time, you're also part of the Genomic Surveillance Committee in the state. Have you discussed this with the state government? Is there a possibility that this can be done at the state level?
No, not at this point in time, but I believe that this is something that states across could consider. I think health is a state subject, and with directions from the center, this could be something that could be discussed and considered at the state level also, to look at states that are extremely active socio-economically, or in states where they see very low seroprevalence. I think those are states that would need to consider this. I would not say as a mandate, but I would say definitely as an option, so that many people who wish to consider the third dose based on their own knowledge, based on global data, and based on the guidelines from the government would find it useful.
And my colleague Revati Rajivan, who brought us that interview with Dr. Vishal Rao, is live with me on the broadcast. Revati, that is a very interesting, suggestion that has been made by Dr. Rao. While we are still doling out the precautionary doses for the 60-plus population, now he says that it is a must now that the 18-plus should also be given a third dose.
That's right, and the argument is that that is the moving population in any state. They are the ones stepping out the most. They are the ones involved in economic activities and social activities as well. So they are the ones probably mostly carrying back the infection back home as well. So while it is, and also he also talks about not waiting for 9 months after the second dose to give the booster dose. So reduce the time gap also to maybe 6 months or 3 months as the case be. So these are the arguments that he's putting forward. Of course, this is coming at a time when Karnataka is seeing a record new number of cases per day. In fact, yesterday we saw more than 40,000 new cases reported from the state. So that is a huge jump from the 27,000 cases that was reported just the previous day. A majority of these cases coming from Bengaluru city alone. And Bengaluru city, considering its population, considering the activities in the city, and the travel, international and interstate travel that takes place from Bangalore and outside. All of these, considering all of these factors, Bengaluru contribute to the maximum number of majority of the cases, of the total cases recorded in Karnataka. So these are all the factors that he's bringing in to argue that the 18 to 60 age group must also be given the booster dose or precautionary dose at this point of time on an urgent basis, considering their involvement, considering their movement in the socio-economic sector there.
Oh, breaking news coming in, this time from the state of Maharashtra. And the Maharashtra government has said that as per data, over 1 crore people in the state are yet to take their second dose of COVID vaccine. This is a concerning number considering we are seeing a rise in the number of COVID cases. 1 crore individuals in the state still not done with the second dose of the vaccine. So like we've been bringing to you, Maharashtra has been one of the worst hit states as far as the rising number of COVID cases is concerned, especially in the wake of the third wave and the Omicron variant. We only see that now the cases have begun to reduce slightly, but these were numbers right after the weekend. We cannot really pinpoint on a certain figure and cannot really underline that the cases have started to reduce in the state of Maharashtra, which, as I would repeat, has been one of the worst hit states in the country. And now there has been a data that's been released by the Maharashtra government, and they've mentioned that over 1 crore people in the state are yet to take their second dose of the vaccination. My colleague Disha Shah now joins me on the broadcast. Disha, this is a very, very concerning figure. 1 crore people still not taken the second jab.
Well, that is right. As far as Maharashtra is concerned, what we understand from the state health department that over 1 crore people have skipped their second dose, which essentially means that these people have, despite the date passing by, they have not taken their second dose. And here we are talking about Covishield as well as the Covaxin beneficiaries. So what we understand, there are about 99 lakh people who have yet not taken their second dose of Covishield, and about 17 lakh people who have yet not taken the second dose of Covaxin. So if you count them together, then there are about over 1 crore people who have skipped their second dose in Maharashtra. About 63% have been fully vaccinated in the state is what we understand, but the number is very huge and concerning at this point. And when we ask the Maharashtra state government about the reasons, they say that there is still a lot of hesitancy amongst the beneficiaries, because once they see that there is a downtrend in the cases, then they completely forget about it. They feel it's not necessary to take the second dose. Secondly, at the 84-day gap, so a lot of people do really forget, because the gap is very long, so they do forget and they feel it's not necessary to take. So there's a bit of apathy amongst the beneficiaries is what people are saying, especially the health authorities, and that is the reason we are looking at this sort of a